Hi, I'm Dr. Wells Stewart, joint replacement specialist with OrthoVirginia in Richmond, Virginia. Today I'm talking about when to consider a partial knee replacement versus a total knee replacement. So in kind of determining that, we need to understand that there are three compartments to the knee. We have the medial, which is the inside, the lateral, which is the outside, and then the patellofemoral, which is behind your kneecap. And so really, first thing to say is that to be a candidate for a partial knee replacement, you really only need to have a problem in one of those compartments. Once you start having wear in the other areas, a partial is not a great option for you. But if you do have wear isolated to one compartment and you really have pain kind of just either on the inside portion or the outside portion or just in the front of the knee, then we can consider a partial. The benefits to the partial are that they can be a faster recovery and less painful up front, and they can feel much more natural than a total knee. We get to leave all the main ligaments inside the knee when we do a partial knee, whereas in a total knee, we're taking out at least one or two of them. The partial knee replacement, why shouldn't we do this? One, like I said, the wear in other parts of the knee. But then the other thing that comes down to, for some patients, is there is going to be a higher rate of another surgery later in life. You can still develop arthritis in the other compartments, or the implant could fail. Now that rate is variable on how much higher it is, but these still should last you a long time. Many of them are still in 20 years later, patients are doing well. So some's going to come down to your own risk aversion profile as you as the patient decide, do I really want one and done? The other thing to consider is age. Sometimes if you're in your 40s or early 50s and you're still very active and you're skiing and water skiing or playing sports, the partial is going to feel more natural, and if that may be the better option for you. The total knee replacement is kind of the gold standard. It's the one where we replace the whole knee, both medial, lateral, and patellofemoral. And it's going to be, it have a lower rate of revision surgery in the future. Now, again, that rate is going to vary based on what study you read, but it's going to take care of the whole knee. But it is going to be a harder recovery, more pain up front, and feel more different than a normal knee. So, I think it's a very individualized approach on decide which of the two you'd like to do. And I think it's important to talk with your surgeon and see what they think. And y'all come together to decide what's going to be the best option for you.